Welcome to Nutritional Red Pill Edition, where we try to assist neglected demographics. Anyway, today we're just going to briefly review some footage from 3 or 4 years ago during the so-called pandemic.
Mr. Speaker, the Health Minister has previously questioned my concern for science, and today I return the favor.
Let me go back to the question for science. 1 second.
Mr. Speaker, the Health Minister has previously questioned my concern for science.
Yeah, what almost no one mentions is there's two branches of science: reductionism on the left, top left, and system science on the right, or holistic science. You want to call it holistic science. Reductionism is in the medical system is disease-driven, aimed for statistical normalcy. Statistical. If you watch my other videos, you see the reference ranges are not normal especially for the individual. Subcomponent view, all the human body is separated into component parts, is for easier study and for easier symptom management. But when you prescribe only drugs and surgeries for singular problems, there's massive side effects. It's good for 10-minute office visits only for simple problems. It's not meant for all the modern day diseases we have now. Acute focus, injuries and trauma, like I said. Antagonist based, mainly using only drugs and surgeries. One size fits all. One pill, surgery, treatment fits all. On the other side, system science, holistic medicine, and holistic has the word holistic has taken on negative connotations over the decades, but it's preventative and restorative driven, aimed for individual optimal, whole body or systems view, metabolic and synergistic focus, synergistic using body native substances. One size doesn't fit all because we're all individuals. So most people don't know there's two types of science. So there you go. Almost no one mentions that. Virtually no one does.
Today I return the favor. At least 75 recent studies have shown that optimal vitamin D levels significantly reduce susceptibility to COVID-19.
See, the problem with quoting one specific vitamin or one specific substance is that you're taking a drug view, a reductionist drug view. You think it's a drug. You have to remember that we're just like plants. And when you talk like that, say just one vitamin D type thing, it's like another drug, just another magical singular pill you take. It shouldn't be like that.
And significantly improve health outcomes if people do get infected.
If you had a house plant, and it was kind of fading green, you would think, is there too much light? Is there too little water? You would look to see if there's toxicities involved or deficiencies. Why do we lead with an expensive pharmaceutical agent when we wouldn't do that with our plant?
Why do we lead with an expensive pharmaceutical agent when we wouldn't do that with our plant? Why? Symptom management and big money, huge money.
Documented for decades that Canadians have suboptimal vitamin D levels, especially during winter.
Not only vitamin D.
Can the minister explain why Health Canada's website states that most Canadians are getting enough vitamin D and doesn't actively recommend supplementing?
And do these people look healthy? If you saw, I'm not bashing him, but he doesn't look that healthy either. If you see pictures of him, I think he's in his late 30s or early 40s. He doesn't look that healthy to me, but I don't know. Maybe there's too much stress or all kinds of things going on. And I've seen a lot of these so-called natural health people. I think his father's a chiropractor or something. All kinds of these natural health people, they don't often look very healthy. They're also not taking a botanist view of the human body. Anyway.
The Honorable Minister.
Yeah.
Thank you, Mr. Speaker, and I would encourage the member opposite to not fall prey to the myriad of fake news articles that are circulating around the internet about ways that people can protect themselves from COVID, and trust that the Public Health Agency of Canada only puts science-based credible documents.
The person on the left there is Theresa Tam, the science officer of Canada. Does she look healthy to you? Does she even look like the gender she claims to be? I don't know. The big Adam's apple there.
Up, guided, of course, by our Chief Public Health Officer, Dr. Tam, and the many scientists that work for us. Mr. Speaker, what Canadians need now is trust, and they need to be able to trust in the information that their elected officials are sharing. And I would urge the member to get his sources from credible sites.
I would say. Yeah, I would say they're not being accurate. They're not being honest.
You're a bad man. You're a very bad man.
Yes, I know. I'm a very bad man. Anyway, I'm trying to make shorter videos to pique interest and you can research the things I say. So if you like what I'm saying, please like and subscribe.